Hello, and thank you for having me. I'm Caitlin McCormick, the Associate Director for Public Policy and Government Affairs here at PCORI. I wish I could be with you in person today, but I'm delighted to deliver this message to your forum. The relationship that PCORI and PIPC have enjoyed over the years is so important for the health research community overall. I thank you for your partnership and support all these years. I don't think I need to introduce any of you to PCORI, but I will mention that over our more than 10 years of funding research, we have now committed about $3.3 billion to more than 1,800 research, dissemination, implementation, and engagement projects focused on comparative clinical effectiveness research, infrastructure projects, including the Patient-Centered Outcomes Research Network, and projects focused on the methods used for our funded research. This year, we launched a strategic planning initiative that will determine the kinds of studies we fund in the future and will help us do our part in reshaping the U.S. healthcare system. And groups like PIPC are critical to us as we engage in this process. And throughout this time, we have sought and will continue to seek input from a wide variety of sources and stakeholders, including all of you. Today, we are focused on a critical process to moving PCORI forward, updating our national priorities for health and our research agenda. Over the past year or so, PCORI has developed our new national priorities for health, a set of high-level priorities that will drive our detailed research agenda for the next phase of PCORI's work. After a robust comment period, our board approved the following as our new national priorities for health: increase evidence for existing interventions and emerging innovation in health, enhance infrastructure to accelerate patient-centered outcomes research, advance the science of dissemination, implementation, and health communication, achieve health equity, and accelerate progress toward an integrated learning health system. This set of aspirational goals will update the national priorities for research that have guided our work this far. Moving from priorities for research to priorities for health is significant, and that the focus is now more on outcomes than on the process for achieving them. You'll note that all of these priorities begin with a strong action verb like advance, accelerate, and achieve. We believe these kinds of words will provide North Stars to guide us in making funding decisions that will provide evidence needed to achieve these goals. We anticipate that this shift towards achieving health goals will also entail partners beyond the formal healthcare system, such as in the fields of education, public health, and housing, all of which play a role in community and individual health. These national priorities will chart PCORI's course for the next phase of our work, and I think will provide many opportunities for further collaboration between our two organizations. With our national priorities for health in place, we have turned now to developing our research agenda. Our draft research agenda has been approved by our board and is now available for public comment. Our research agenda provides a framework for achieving progress on the national priorities for health, specifically through the strategy of funding comparative clinical effectiveness research. The research agenda will then help guide the development of an iterative research project agenda, which will be informed by an ongoing stakeholder-engaged input process. The research project agenda is where specific topics reside, such as intellectual and developmental disabilities and maternal morbidity and mortality, both of which were specifically identified in PCORI's reauthorization legislation. The proposed research agenda comprises 6 statements that all begin with fund research that, to emphasize the connection to funding CER. The 6 statements are: fund research that fills patient and stakeholder prioritized evidence gaps and is representative of diverse patient populations and settings; fund research that aims to achieve health equity and eliminate health and healthcare disparities; fund research that builds the evidence base for emerging interventions by leveraging the full range of data resources and partnerships; fund research that examines the diverse burdens and clinical and economic impacts important to patients and other stakeholders; fund research that focuses on health promotion and illness prevention by addressing health drivers that occur where people live, work, learn, and play; fund research that integrates implementation science and that advances approaches for communicating evidence so the public can access, understand, and act on research findings. This research agenda will be open for public comment through the end of January, and I urge you to submit your input for our consideration. Other things that we have been working on rolling out at PCORI include the provision of our reauthorization that authorized our full collection of the full range of outcomes data, meaning that future PCORI-funded research can now include consideration of economic impact of health interventions. This means not only traditional measures of utilization and costs, but also a specific focus on the non-medical costs to patients and families, such as caregiver burden, workplace productivity, and absenteeism. It's important to note that this language does not remove the statutory prohibitions on PCORI establishing cost per quality adjusted life year quality thresholds, or allow PCORI to conduct cost effectiveness analyses. PCORI has been working through an approach to this new provision that ensures transparency, notably patient engagement throughout implementation, considers the full range of treatment options, develops standards about identifying, capturing patient-centric cost data, addresses concerns around the use and misuse of cost data that could lead to cost effectiveness or inappropriate value assessment, and hopes to expand beyond traditional health economic perspectives on cost and value. To guide the use of this data, we have developed 4 principles. First, considering the full range of outcomes important to patients and caregivers, including burdens and economic impacts, is central to PCORI-funded research. Second, PCORI-funded research may consider the full range of outcomes relevant to other stakeholders when these outcomes have a near-term or longer-term impact on patients. Third, the collection of data on potential burdens and economic impacts of treatment options must be appropriate and relevant to the clinical aims of the study. And finally, fourth, PCORI may support the conduct of certain types of economic analyses as part of a funded research study or independently to enhance the relevance and value to patients and other stakeholders of information PCORI-funded investigators collect on potential burdens and economic impacts. To further support our research in appropriately collecting and using this data, we are establishing an economic resource center that will provide further technical advice and guidance. In addition, we will be funding a series of engagement awards that provide program support to further exploring the topic of economic impact data in research. In other new developments, we recently held a request for information on the science of engagement. In this RFI, PCORI sought input to inform the potential development of a science of engagement funding initiative. Science of engagement is the systematic study of methods for and outcomes of engagement to inform high-quality, patient-centered research. Expanded funding for science of engagement could address high-priority knowledge gaps on approaches for effectively engaging diverse stakeholders throughout the research process. The Science of Engagement initiative could potentially involve 2 complementary, interrelated research program approaches: standalone research awards on engagement in research and studies within a study for ongoing PCOR-CER awards. The intention of these complementary mechanisms would be to help create a strong evidence base of answers to critical research gaps that could be addressed to make engagement more effective and widespread. And as always, we continue to focus on improving the science of engagement in many ways. We've also developed a series of learning resources found on our website that can be used by researchers to help them succeed in conducting research in multi-stakeholder teams. It addresses 2 key areas: engaging stakeholders to be active members of the team and working together as a productive team. We've also developed a Research Fundamentals program, which is a free, comprehensive training package that offers different ways to learn about the health research process and be involved in patient-centered outcomes research. It's designed to help you understand the language and logic of the research process in an engaging and easy-to-grasp way. These new resources encapsulate what we have learned to date to support the practice of engagement. PCORI is always looking at how to fill gaps in evidence in the science of engagement to continue to support our awardees and stakeholder communities in PCORI. I'd like to thank you again for having me and reiterate PCORI's support for patient-centeredness in all research initiatives. We believe this is a core value of our health system and is at the heart of everything we do here at PCORI. I'll also leave you with a plea. Please submit your comments about our draft research agenda and spread the word far and wide with your colleagues and contacts. You can submit comments through our website either through formal written comments or through more informal methods, including leaving us a voice message. This is a really important way for the community to let PCORI know what they care about, so please spread the word about this opportunity. Thank you again, and I wish you all the best in the rest of your forum. Have a great day.